Hello, I am Russ Calicutt, the Director of Business Development for KONZA, and this is our Analytic Toolkit. This Analytic Toolkit has been created specifically for the use of health information exchanges and the clinical data from disparate electronic medical records. I'm going to walk you through a couple of our dashboards so you can see how our dashboards can help your members reduce cost, improve quality, and improve the provider experience by giving providers the tools they need to be successful in a value-based world. When you log into our analytic toolkit, you can see all the different types of dashboards that we can provide your HIE members. The first dashboard that I'd like to show you is our high-risk patients. This dashboard can be particularly helpful for providers looking to target their patients that are high risk and also seek care at one of the highest cost settings in the healthcare system, the emergency room. So you can see that we consider a high-risk patient a patient with 3 or more chronic conditions and 5 or more emergency room visits. We've broken down the patients by condition, by the top 5 chronic conditions, gender and age, and also number of emergency room visits. So if one of your provider members would like to see their patients with 21 to 50 emergency room visits in the past 12 months, they could just drill down into this graphic. When you drill down into the graphic, it's going to produce a patient list for you. So this would allow your providers or care coordinators or whoever uses your HIE that is utilizing these dashboards, where they can use this patient list to reach out to those patients to make sure that they're seeking care in a more appropriate setting. If I was to give you a deeper dive of our analytics, I could show you how you could also see the diagnosis, treatments, and et cetera that the patients are receiving while they're in the emergency room. The next dashboard that I'd like to preview for you is our controlled substances dashboard. Given the sensitivity around this topic and the opioid epidemic we're currently experiencing, we felt this tile is appropriate to help providers with opioid stewardship. In this dashboard, we can show you what facilities are prescribing the most opioids for your patients. You can see the patients with 3 or more opioid prescriptions that have either been written or administered to them in the hospital or emergency room. You can also see the top 5 opioids that have been prescribed for your patients. I'm going to take you directly into one of these drill down lists so you can see your patients that have 3 or more opioid prescriptions, or that have had 3 or more opioids administered to them in an inpatient or emergency room setting. This list is also drillable as well. So if you drill down into this, we can also provide specific data such as prescribing provider, the name of the opioid that has been prescribed, and when the prescription was written. We also provide many more dashboards that can help your providers with improving quality, reducing cost, helping meet their conditions of participation with Medicare through our new Acute Alerts product. And all of these dashboards have been created specifically for the use of health information exchanges with multiple electronic medical records feeding data into their system. So if you have any more questions and would like to see more of our analytic toolkit, or you are interested in using these analytics within your own health information exchange, please reach out to me by phone or email, and I would be happy to connect with you. Thank you for your time, and watching this video, and I hope to speak with you soon. Thank you.